The news of this measles case comes just a week after an NBC5 Investigates report uncovered potential health care gaps in the city's migrant mission.
Our investigative reporter Bennett Haeberle joining us now with what he's learning about this case in particular, but also those other gaps you've noticed.
That's right, Stephen and Allison. You mentioned that young child who contracted measles is now no longer infectious and has recovered, but measles has both an incubation and an infectious period, meaning this child could have been sick days or weeks ago. It's still unclear, but it does raise questions about what and when did the city and the shelter operator know about this particular case. The Halstead Migrant Shelter is the city's largest, at one time housing more than 2,500 people. That figure, NBC5 Investigates has learned, is now closer to 1,800, nearly a third of whom are children.
This is congregate shelter. It's not designed as long-term permanent housing.
City officials acknowledged during this council committee hearing in late January that the Halstead Shelter did not have a designated isolation room.
Although they've been able to space people out a little bit better, my understanding is that it's still very challenging.
Dr. Evelyn Figueroa helps operate the Pilsen Food Pantry, located roughly a mile away from the shelter where a child recently contracted and recovered from measles. Figueroa is also connected with a group of medical volunteers who for months have pushed to gain access to the shelters to help provide health screenings. So far, the group has not been granted access, but she tells me their talks with the city are ongoing.
Although we're disappointed to still not be coming inside of the shelters and providing health screenings, we do have connections with families inside of those buildings, and we can use those connections to help educate and connect people to vaccinations.
Those who've been vaccinated are considered immune from measles, she says, but migrants here are still being forced to remain inside the shelter until their vaccination status can be confirmed. As NBC5 Investigates first reported last week, our review of thousands of pages of city records revealed potential gaps in the city's response to migrants' health needs. The internal records show as far back as October, the city was aware that overcrowding individuals at shelters put both new arrivals and shelter staff at higher risk of contagious illnesses, and that a lack of space within the shelter system increased challenges to getting people initial health care. Do you think those gaps are still in existence, or have those been closed?
I think the gaps are less large than they were before, but I don't believe that they've been completely resolved.
Dr. Figueroa says there is a need for more personnel on the ground to help quell hysteria and educate migrants on the benefits of vaccines. In response to our findings, Mayor Brandon Johnson has defended the city's efforts.
It just wasn't right the way people were arriving here, and we were responding to it to the best of our ability.
Favorite Healthcare Staffing, which staffs and operates the city's shelters, has been paid $126 million so far. Spokeswoman for that company referred our questions back to the Chicago Department of Public Health, which also did not answer our questions but provided another copy of today's press release. The mayor's office says this measles case, by the way, should have no impact on that March 16th deadline for migrants to start to leave their shelters. Allison?
Bennett, thank you.
Sure.